Us now is our Daryl Huff to expand on his story. Daryl, you're looking into this issue on Molokai. What's something that people should know about this, having already seen that first piece?
Well, I think what we saw in that piece and what I sensed over there is a sense of just sort of sadness and despair, frustration. People have to fly to get to specialists. They don't have access to the health care that they deserve over there. And it is really what we're talking about later in our 6 o'clock story today is about how this is a statewide problem. It's not just Molokai. Molokai is the worst example right now because it is so isolated, but this is a statewide problem. It's a full-on crisis.
What can be done to fix this?
Okay, well, one is money. You know, an awful lot of it is about money. The reimbursements from government health care programs like Medicare and Medicaid are too low to support these rural practices. I was told that the reimbursement for Medicare here in Hawaii is no different than it is in Ohio or Indiana, and that we have a much higher cost of doing business. One of the solutions that's been suggested is that we get a special exemption for Medicare from Congress to basically pay our rural providers more out of Medicare. And a lot of other things are pegged to Medicare, things like reimbursement from private health insurance, Medicaid, so that would make a big difference, just to make enough money for these folks to get by, because these doctors, they're losing money to serve these communities.
All of this sounds like a long shot, though, to become a reality. Is that the case?
Yeah, they're just hanging in there. These doctors are just hanging in there. And we really saw impacts on patients, people who are going with chronic conditions undiagnosed. I've talked to family members of people who said that they do truly believe that for lack of care, their elderly relative died early.
That's such a heartbreaking thing to hear. Looking forward to the other stories in this series. You have 2 more, right?
2 more.
Tell us about those.
So today we're looking specifically at why the providers are struggling so much, and that's all about the low reimbursements, the lack of support for rural health care versus urban health care. Tomorrow is a very interesting story about the airline that serves Molokai, Mokulele Airlines, which has so many complaints about their reliability. They say they're absolutely getting better. They brought in a bunch more planes. They're getting a lot better. But down the line, they may be facing competition that could literally knock them out of business.
And also, you yourself flew to Molokai, and I overheard you had some problems there. Can you tell us about that?
If our spot check of the travel was not particularly successful, we were an hour and 45 minutes late arriving, another hour or so getting off the island. And people told us that's pretty typical, although the airline, again, says we're getting a lot better. So we'll see.
All right. Well, our Daryl Huff with a special series out of Molokai. Daryl, thank you so much for this.
My pleasure, Dylan. Thanks.